Hello viewers, welcome back. I'm Dr. Paul. I would like to express my gratitude for the overwhelming response I got from my previous videos. Now if you haven't already, hit that subscribe button and click the bell icon. I try to bring you information about everyday health related events that happen in all our lives. Of the friends and family who reach out to me for advice, I have found that the most distraught group are the ones who are newly diagnosed with hypertension or high blood pressure. Now, they would have picked up bits and pieces of information from here and there saying how hypertension is incurable, how it's a lifelong disease, how it can lead to various serious complications. So, their anguish and despair is quite understandable. But in reality, the diagnosis of hypertension isn't that bleak. Far from it. But there are certain hurdles a person must navigate through before he can fully understand what is hypertension, what it means for him to have hypertension, and how he can effectively manage hypertension without the condition becoming a life-altering event. Now, the first of these hurdles is the question, have I become a patient now? Now, this person would never have required a doctor ever before in his life. He would have his BP checked, maybe even for an unrelated reason, and found it to be elevated. Does that mean I have become a patient overnight? Have I become an afflicted? To answer this question, we must understand how hypertension develops. Now, hypertension can be caused by an underlying disease or a condition like a hormonal imbalance or the narrowing of an important blood vessel in the body. Then it's called as secondary hypertension. Now, while it is important to look for these causes, we must understand that secondary hypertension only constitutes a minority of the patients with hypertension. The overwhelming majority has something called as essential hypertension, which means there is no specific underlying cause for the disease. Now, with the passage of time, the blood vessels in our body become thicker, rather stiffer, and less compliant. In other words, they lose their ability to dilate and contract. The body needs to regulate the amount of blood flow to various important organs in the body, for example, the kidneys, on a minute to minute basis. The body does so by dilating or contracting the blood vessels supplying these organs. It is called as autoregulation. The body produces various molecules like vasopressin, angiotensin, epinephrine, etc., which helps in this autoregulation. Now, as time passes and the blood vessels become stiffer, they respond less to these molecules. As a consequence, body has to increase the production of these molecules and an imbalance of these molecules ensues, which results in an overall elevated BP. And when does these changes to the blood vessels, in other words, atherosclerosis starts? It starts in the intrauterine life, that is even before you were born, and progresses as time advances. So, essential hypertension can be thought of as a change that happens in the body over time. Now, a few decades ago, when the life expectancy was around 60 years, people didn't live long enough for these changes to result in hypertension. Now, with people living up to the ripe old age of 80, 90 or even 100, it has become a question of when rather than if. And if you hit that magic number of 140/90, or it needn't be 140/90, it could be a different value for you depending upon your profile. So if you had hit that value which is considered as elevated BP or hypertension for you, it doesn't mean that you have become a patient or an afflicted. You are the same healthy person you were before the diagnosis. So, once you are past this self-stigmatization of being a patient or being an inflicted, you will be open to the various treatment options available to you and the hurdles that come with them. So if you like this video, be sure to hit the like button and don't forget to hit the bell icon so that you don't miss the part 2 video in which I speak about the other hurdles in this journey. Thank you for your patient listening.